Do you mix multiple vitamins thinking you're boosting your health? You're definitely not alone, but here's the scary truth. Over 24,000 people in the US end up in the emergency room every year due to supplement misuse. And most of them had good intentions, just like you. The problem? Some supplements don't work well together. In fact, certain combinations can cancel each other out, build up to toxic levels, and even lead to serious health problems like heart issues, nerve damage, or dangerous bleeding. You see, supplements aren't one size fits all. And mixing them randomly can quietly sabotage your health over time, especially as we age. That's why today, we're breaking down 7 dangerous supplement combinations you should never take together, and the right way to take them safely. Stick with me, because even healthy habits can become harmful if you don't know what's going on inside your body. Let's get started. Number 1, Vitamin C plus Vitamin B12, the combo that drains your energy. Let's talk about one of the most common, and surprisingly harmful, mistakes people make when it comes to daily supplements, combining vitamin C and vitamin B12. On their own, both of these vitamins are incredibly important, especially for seniors. Vitamin C is well known for its role in strengthening the immune system, fighting inflammation, and protecting the body from oxidative stress. Meanwhile, vitamin B12 is absolutely essential for maintaining healthy nerve function, producing red blood cells, and supporting cognitive health. If you're over 50, B12 becomes even more critical, as natural absorption tends to decline with age. Now here's the part many people don't know. When you take high doses of vitamin C at the same time as vitamin B12, especially on an empty stomach first thing in the morning, you may actually be blocking your body from absorbing the B12 properly. Why does this happen? Well, vitamin C is highly acidic, and in large amounts, it can actually degrade or neutralize B12 in your digestive tract before your body has the chance to absorb it. So instead of helping your body, that big glass of orange juice with your morning B12 supplement may be working against you. This interaction is subtle but dangerous over time. You may not notice it right away, but gradually, the signs of vitamin B12 deficiency can start to creep in. We're talking about symptoms like chronic fatigue, tingling or numbness in the hands and feet, poor concentration, and even memory lapses. In more severe cases, long-term B12 deficiency can lead to nerve damage that may be difficult to reverse. And what's most frustrating? You could be faithfully taking your supplements every single day and still develop a deficiency, just because the timing is off. So, what's the solution? Thankfully, it's simple and effective: timing. Instead of taking vitamin C and B12 together, space them out by at least 2 hours. For example, you could take your B12 supplement in the morning with breakfast, then wait until mid-morning or lunch to have your vitamin C or citrus-rich drink. This small adjustment makes a big difference in how your body absorbs and utilizes each nutrient. It allows you to get the full benefit of both vitamins without them interfering with each other. Remember, just because supplements are over-the-counter and seem harmless doesn't mean they're foolproof. The body is a complex system, and even natural vitamins can compete or conflict when taken incorrectly. If you're serious about supporting your energy levels, brain function, and long-term vitality, then understanding how your supplements interact is key. Start today by checking the timing of your daily vitamins. Your nervous system, your energy, and even your memory will thank you. Number 2, Copper plus Zinc, the silent battle that weakens immunity. At first glance, copper and zinc seem like a power duo when it comes to supporting your health. And they are, when taken the right way. Both are essential minerals that play critical roles in the body, especially for older adults looking to maintain strong immunity and energy levels. Copper helps your body produce energy, form collagen, which keeps skin and joints strong, and supports immune defenses. Zinc, on the other hand, is a key player in wound healing, hormone balance, and immune function. So, It would make sense to take them together for an added boost, right? Well, not exactly. Here's the problem: zinc and copper compete for absorption in the digestive system, and zinc almost always wins the battle. Zinc is more aggressive in the gut, and when taken in higher doses, especially over long periods, it can suppress your body's ability to absorb copper. This creates an imbalance that may quietly lead to a copper deficiency without you even realizing it. So what does that mean for your health? A lack of copper in the body can cause some pretty serious symptoms. You might start feeling more tired than usual, experience unexplained anemia, or notice that you're extra sensitive to cold. Some people develop brittle bones or joint problems, and because copper plays a role in iron metabolism, your red blood cells can suffer too. The tricky part is that these symptoms can often be mistaken for other conditions, or even dismissed as just getting older. In reality, the issue could be something as simple as taking zinc too often without balancing it properly with copper. And this is more common than you might think. Many seniors take zinc daily to support their immune system, especially during cold and flu season. But without enough copper, the long-term effect could actually weaken your immune defenses, not strengthen them. So, what's the fix? It all comes down to timing and moderation. Experts recommend taking zinc and copper at different times of the day, ideally spaced at least 2 hours apart. If you're taking higher doses of zinc regularly, say, for immune support, it's smart to talk with your doctor or a nutritionist about how to incorporate copper safely. In some cases, alternating days may work better, depending on your body's needs and any existing health conditions. Also, be mindful of multivitamins or supplements that contain both zinc and copper. While they're often included together, the balance may not always be ideal for everyone, especially older adults with changing nutritional needs. Remember, maintaining strong immunity and overall vitality isn't just about what you take, it's also about how you take it. So don't let this silent mineral battle go unnoticed. By spacing out your supplements and getting expert guidance, you'll ensure your body gets the full benefit of both these vital nutrients, without one stealing the spotlight from the other. Number 3. Ginkgo Biloba plus Omega-3 fatty acids. Double blood thinners can be deadly. It's easy to understand why so many people turn to Ginkgo Biloba and Omega-3 fatty acids as part of their daily supplement routine. Both are backed by science and offer well-known health benefits. Ginkgo biloba is a powerful herbal remedy often used to improve blood flow to the brain, support memory and mental clarity, and even reduce symptoms of dizziness or tinnitus. Meanwhile, omega-3s, commonly found in fish oil supplements, are prized for their ability to reduce inflammation, protect heart health, and support vision and brain function. Taken separately and under the right conditions, these supplements can be incredibly beneficial, especially for aging adults. However, what many people don't realize is that both Ginkgo biloba and omega-3s also share a very important side effect: they thin the blood. This means they reduce the blood's ability to clot, which can be useful in preventing strokes or heart attacks. But when you combine two powerful blood thinners, without medical guidance, you increase the risk of something far more dangerous: internal bleeding. This isn't just about getting a bruise that takes a little longer to heal. We're talking about potentially life-threatening complications like gastrointestinal bleeding, spontaneous bruising, or bleeding in the brain. This risk is even higher if you're already taking prescription blood thinners like warfarin, aspirin, or clopidogrel. Even something as routine as a dental cleaning, minor surgery, or bump on the leg could spiral into a serious medical event if your blood is too thin to clot properly. It's especially important for older adults, who may already be dealing with fragile blood vessels, high blood pressure, or slowed healing. Here's where things get dangerous. Ginkgo biloba and omega-3s are both natural, which gives many people a false sense of security. But natural doesn't mean harmless, especially when combined with other medications or supplements that affect blood flow. So, what's the smart move? If you're considering taking both Ginkgo Biloba and omega-3 fatty acids, you should absolutely speak with your doctor first. Don't combine these on your own, especially if you're preparing for surgery, dental work, or you're on any blood-thinning medications. If your doctor does approve the combination, they'll likely recommend routine monitoring of your clotting factors, dosage adjustments, and regular checkups to keep you safe. Both of these supplements can support your health, but together, they may work too well. Before you combine them, make sure your doctor is in the loop and managing the risks with you. Your blood is a delicate balance, and tipping that scale too far could lead to serious harm. Number 4, magnesium plus calcium, when bone builders start competing. At first glance, magnesium and calcium seem like a perfect match. After all, both are essential for strong bones, healthy muscles, and overall vitality, especially as we age. Calcium is the mineral most people associate with bone strength and muscle contraction, and it's often recommended to help prevent osteoporosis and fractures later in life. Meanwhile, magnesium plays a quieter, but equally critical role. It helps regulate nerve signals, muscle relaxation, blood sugar levels, and even heart rhythm. But here's what most people don't realize: when it comes to these two minerals, more isn't always better. In fact, if you take too much calcium without enough magnesium to balance it out, you might end up causing more harm than good. Why? Because high levels of calcium can interfere with magnesium absorption in the digestive system. These minerals compete for the same pathways in the intestines, and calcium often takes the lead. That means even if you're consuming magnesium through your diet or supplements, your body might not be able to absorb enough if calcium levels are too high. What happens then? A magnesium deficiency, caused not by lack of intake, but by poor absorption, can lead to a host of issues. You might begin to experience muscle cramps, fatigue, or even twitching. In more severe cases, low magnesium levels can lead to weakness, irregular heartbeat, and an increased risk of heart disease. And the scary part? These symptoms can creep up gradually and are often mistaken for other health problems or simply attributed to aging. This mineral imbalance is especially common in seniors who are focused on bone health and taking daily calcium supplements, sometimes without realizing they need to also support their magnesium intake. It's not that calcium is the villain here, it's that the ratio between the two matters deeply. So, what's the best way to take both without causing a nutrient traffic jam in your system? Health experts recommend maintaining a calcium to magnesium ratio of 2 to 1 or lower. For example, if you're taking 1,000 milligrams of calcium daily, aim for at least 400 to 500 milligrams of magnesium. This balance helps ensure your body absorbs both minerals effectively, without one overpowering the other. It's also wise to take them at separate times of day, for instance, calcium with breakfast and magnesium with dinner. This timing strategy can improve absorption and reduce digestive discomfort. And if you're using a multivitamin or bone health supplement, be sure to check the label. Some combinations are poorly balanced, even in popular brands. In the end, supporting your bones, heart, and muscles means giving your body the right nutrients, in the right amounts and at the right times. Magnesium and calcium can absolutely work together, but only when you let each one shine on its own. Number 5, vitamins D plus E plus K, when good fats fight for absorption. Vitamins D, E, and K are often hailed as nutritional powerhouses, especially for those of us looking to stay healthy as we age. And rightly so. These are all fat-soluble vitamins, meaning they need dietary fat to be properly absorbed by the body. Each of them plays a unique and vital role in maintaining your health. Let's break them down. Vitamin D helps with calcium absorption, strengthens bones, and supports immune function. Vitamin E is a powerful antioxidant, protecting cells from damage caused by free radicals, something especially important as we get older. And then there's vitamin K, which plays a crucial role in blood clotting and also helps prevent calcium buildup in arteries, supporting cardiovascular health. So if all three are essential and fat-soluble, it might seem like a good idea to take them all together, right? Well, not quite. Despite being beneficial on their own, taking high doses of vitamin D and vitamin E together can interfere with the absorption of vitamin K. That's because these vitamins compete for the same transport mechanisms in the body. When you flood your system with large amounts of D and E, especially from supplements, it can crowd out vitamin K, making it harder for your body to use it effectively. And that's a big deal. When your vitamin K levels drop, your body may struggle to clot blood properly, increasing the risk of bruising or bleeding. Even more concerning, inadequate vitamin K can lead to calcium being deposited in the arteries instead of in the bones, increasing the risk of bone loss and heart disease over time. This kind of interaction isn't immediately obvious, which makes it especially dangerous. You could be faithfully taking your supplements, thinking you're covering all your nutritional bases, while a silent imbalance slowly puts your health at risk. So what's the smart approach? First, don't panic. These vitamins are still important and can be taken safely. The key is timing and balance. To avoid competition and maximize their benefits, it's best to space them out by at least 2 hours. For instance, you might take vitamin D with breakfast, vitamin E at lunch, and vitamin K with dinner. This gives your body a better chance to absorb and process each one without conflict. Second, since these are fat-soluble, make sure to take them with meals that include healthy fats, like avocado, olive oil, nuts, seeds, or fatty fish. Fat enhances absorption and ensures these nutrients reach where they're needed most. As we age, every small adjustment to our health routine can make a big difference. Understanding how even beneficial nutrients can interfere with each other helps you make smarter choices, stay safe, and get the most from your supplements. Number 6. Vitamin C plus iron, the overload that damages organs. At first glance, vitamin C and iron seem like a perfect health-boosting pair, and in many cases, they are. If you've ever been told to drink orange juice with your iron supplement, there's good reason for that. Vitamin C enhances the absorption of non-heme iron, the type found in plant foods and most over-the-counter supplements. This can be especially helpful for people struggling with iron deficiency anemia, helping to raise iron levels more effectively and prevent fatigue, weakness, and brain fog. But here's the catch: too much of this combination can backfire. When taken in excess, vitamin C can actually increase iron absorption to unsafe levels, leading to iron overload. While this may not be a problem for everyone, it's a serious concern for certain individuals, particularly those with a genetic condition called hemochromatosis. People with this condition naturally absorb more iron than they need, and when they unknowingly pair it with high doses of vitamin C, their risk of iron toxicity skyrockets. So, what does iron overload actually do to your body? Too much iron doesn't just sit harmlessly in your system, it starts depositing in vital organs, especially the liver, heart, and pancreas. Over time, this can lead to liver damage, heart disease, hormonal imbalances, and even early aging due to increased oxidative stress. And the scary part? These symptoms often build up slowly and quietly. You may feel fine until you're not. Even if you don't have hemochromatosis, regularly combining high doses of iron with large amounts of vitamin C can still tip the balance too far. That's why iron supplementation should never be a guessing game. It's not just about getting enough iron, it's about getting the right amount for your body. So how can you use this combination safely? First, and most importantly, get your iron levels tested before starting supplements. A simple blood test can show whether you truly need extra iron. If you do, pairing it with a moderate amount of vitamin C, under a doctor's guidance, can still be very effective. But more is not better. Stick to the recommended dosages on your supplement labels, and avoid combining iron and vitamin C unless it's necessary and advised. If you're already eating a diet rich in iron, like red meat, spinach, or lentils, you may not need extra iron at all. Also, be cautious with multivitamins that contain both iron and vitamin C. It may seem convenient, but for some, it can quietly push iron levels into unsafe territory over time. The bottom line? Iron and vitamin C can be a powerful duo, but only when used mindfully. Your liver, heart, and long-term vitality depend on it. Number 7, calcium plus iron, the nutrient block that leaves you tired and weak. Both calcium and iron are vital minerals that support essential functions in the body, especially as we age. Calcium is widely known for its role in building and maintaining strong bones and teeth, supporting muscle function, and ensuring proper nerve transmission. Meanwhile, iron is the backbone of red blood cell production and oxygen transport. Without it, your body simply can't deliver enough oxygen to tissues and muscles, which leads to tiredness, weakness, and eventually, anemia. But here's the hidden danger that many people don't realize: when calcium and iron are taken together, they actually compete for absorption in the intestines. And calcium, being the more dominant mineral in this matchup, usually wins. That means that even if you're taking a high-quality iron supplement to correct a deficiency, if you also take it with a calcium-rich food supplement at the same time, your body may absorb far less iron than intended. And over time, that adds up. So what happens when your body isn't absorbing enough iron? You may start to notice fatigue that doesn't go away with rest, shortness of breath during normal activities, or cold hands and feet. Some people develop pale skin, or feel dizzy and weak. These are classic symptoms of iron deficiency anemia, which is especially common among older adults, yet often misattributed to just aging. In reality, the issue could be as simple as how your supplements are timed. The interaction between calcium and iron is well documented in medical research, but it's often overlooked in daily routines. Many multivitamins, for example, contain both minerals, which seems convenient, but it actually reduces the effectiveness of both. Others may take iron supplements right after breakfast, not realizing that milk, yogurt, or fortified cereals can interfere with its absorption due to their high calcium content. So, how can you make the most of both nutrients? Here's the solution: never take calcium and iron at the same time. Instead, space them out by at least 2 hours to give your body time to absorb each mineral effectively. Ideally, you should take iron on an empty stomach, or with a small amount of vitamin C, such as orange juice, to improve absorption. If an empty stomach causes discomfort, take it with a light meal that's low in calcium. On the other hand, calcium is best taken with food, which also reduces the chance of digestive upset. This way, you're getting the full benefit of both minerals, without one blocking the other. In summary, calcium and iron are both essential, but they don't play well together at the same time. With a little attention to timing, you can keep your bones strong, your blood healthy, and your energy levels where they should be, without unwanted nutrient clashes. Smart supplement combinations that work, when 1 + 1 equals better health. Not all supplement combinations are harmful. In fact, some work beautifully together, enhancing each other's effects and helping your body absorb nutrients more efficiently. When taken properly, these smart pairings can offer powerful health benefits, especially for older adults who want to protect their bones, heart, brain, and immune system. Let's take a look at 4 combinations that truly work, when used the right way. Vitamin D plus vitamin K2, the bone and artery duo. This is one of the most important combinations for seniors. Vitamin D helps your body absorb calcium, which is critical for maintaining strong bones and teeth. But here's the twist: without guidance, that calcium can end up in the wrong places, like your arteries or soft tissues, contributing to arterial calcification and increasing your risk of heart disease. That's where vitamin K2 comes in. K2 acts like a traffic director for calcium, guiding it into your bones and teeth, and keeping it out of your arteries. When taken together, D and K2 form a powerful team that improves bone density while also protecting your heart. Vitamin D plus magnesium, unlocking D's power. Many people take vitamin D regularly, but here's something few realize: without enough magnesium, your body may not be able to activate vitamin D at all. Magnesium is involved in converting vitamin D into its usable, active form. Without it, even high doses of vitamin D might do very little. Pairing these two helps ensure you're not only absorbing D, but actually using it effectively. This combo supports your bones, immune system, heart, and mood. It's especially important for older adults who may be low in magnesium due to reduced dietary intake or medications. Vitamins A, D, E, and K, the fat-soluble family. These 4 vitamins have something in common: they're all fat-soluble, meaning they require dietary fat to be properly absorbed. If you take them on an empty stomach or without enough healthy fat in your meal, you may not absorb much at all. The solution? Pair these vitamins with foods like avocado, olive oil, nuts, seeds, or eggs. Whether you're using a multivitamin or individual supplements, taking them with fat-rich meals ensures your body actually receives the full benefit of each nutrient. This group supports vision, skin health, bones, hormones, and cardiovascular function. Vitamin E plus omega-3 fatty acids, anti-inflammatory powerhouse. This duo is fantastic for heart and brain health. Omega-3s reduce inflammation, support cognitive function, and lower triglycerides, while vitamin E acts as a powerful antioxidant that protects your cells from damage. Taken together, they form a true protective shield for your cardiovascular system. But there's one caution: both have mild blood-thinning effects, so if you're on anticoagulant medications, consult your doctor before combining them. When used wisely, the right supplement combinations can amplify your health goals rather than sabotage them. It's all about timing, balance, and knowing which nutrients work together, not against each other. Common supplement mistakes to avoid: 5 dangerous habits that seniors should stop. Taking supplements can be an excellent way to support your health when done correctly. But far too often, well-meaning habits can backfire, especially as we age. Many seniors take multiple vitamins and minerals daily, but how and when you take them matters just as much as what you take. If you're not careful, these everyday routines can lead to nutrient imbalances, poor absorption, or even dangerous side effects. Let's walk through 5 common supplement mistakes that are easy to fix, once you know what to look for. Number 1. Taking all supplements at the same time. It may seem simple to swallow all your pills with breakfast and get it over with, but this can cause more harm than good. Some nutrients compete for absorption, while others may need to be taken with food or on an empty stomach. For example, calcium can block iron, vitamin C can degrade B12, and fat-soluble vitamins need dietary fat to be absorbed. Space your supplements throughout the day and group them based on compatibility and your meal schedule. Number 2. Trusting generic multivitamins without reviewing combinations. Multivitamins often look convenient, but many contain poor quality ingredients or imbalanced doses. Worse, they may combine nutrients that interfere with each other, like calcium and iron, or pack in unnecessary additives, fillers, and artificial colors. Always read labels. Choose reputable brands that base their formulations on science. Better yet, ask a doctor or nutritionist for guidance based on your specific health needs. Number 3. Not telling your doctor about your supplement list. Many people assume supplements are harmless and don't need to be mentioned during doctor visits. But supplements can interact with prescription medications, medical conditions, or even planned surgeries. For example, combining fish oil with a blood thinner can increase bleeding risk. Always bring a list of everything you're taking, including vitamins, minerals, and herbs, to your doctor appointments. It could prevent a serious interaction. Number 4. Ignoring timing and food interactions. Did you know that when and how you take your supplements affects how well your body absorbs them? For instance, fat-soluble vitamins A, D, E, K must be taken with healthy fats, iron should be taken away from calcium, and some supplements work best on an empty stomach. Learn the best time and method for each supplement you take. Adjusting your routine can greatly improve effectiveness. Number 5. Taking megadoses without testing first. More is not always better. High doses of certain vitamins can cause toxicity over time. Too much vitamin A can cause hair loss, while excess vitamin B6 can lead to nerve damage and tingling. Others, like vitamin D, can build up and harm the liver, kidneys, or heart. Never guess what your body needs. Get your nutrient levels tested and only supplement what you're lacking. By avoiding these common pitfalls, you'll get more from your supplements and reduce your risk of side effects. With the right knowledge, supplements can truly support healthy aging, safely and effectively.